Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and our weekly update for Tuesday, November 30th. Currently, the Tri-County is at 57,580 cases. That is an increase of over 1,000 cases in the past week. That now brings Peoria to 28,981. Again, that's 28,981, an increase of 510 cases in the past week. Tazewell County is now at 22,139, which is an increase of 505 cases for the past week. Again, that was 22,139. And Woodford County is currently at 6,460 cases, which is an increase of 152 over the past week. Our deaths to date for the Tri-County sadly are at 868, which is an increase of 5 over the past week, with Peoria at 422 and Tazewell at 340. Woodford County remains at 106. Right now in the Tri-County, we have 1,353 cases at home and isolating, which is about a 200 case increase from the previous week. And we have 34 cases currently hospitalized, an increase of 5 since last week. Our Tri-County average now sits at 167 cases each day, compared to 150 last week. And we see the same increase in Peoria County specifically, where we now average 73 cases a day compared to 70 just 1 week ago. OSF St. Francis Medical Center, UniPoint Health Central Illinois are reporting 13 ICU beds in use and 74 non-ICU beds in use. And they are sad to report 3 deaths related to COVID in the past 24 hours. In terms of our hospital system capacity, they are now continuing to average 21 ICU beds, while we've seen an increase in non-ICU capacity, now averaging 68 compared to 51 in the previous week. There's been a lot of changing news around not only COVID-19 in terms of the variants, but also vaccinations. To speak more about the changes that we're seeing in terms of the variant, our guest today is Dr. Ahmad, staff physician, infectious disease at OSF St. Francis, and associate professor of medicine at the University of Illinois College of Medicine, Peoria.
Hi, everyone. I will be talking briefly about the new variant, the Omicron variant, because this is the hottest topic right now. I'll just go over the basic history. First, this variant was first reported to World Health Organization from South Africa on 24th November. What they found in the recent weeks was the infections were increasing steeply, and they found a certain burst of cases amongst university students in the city of Pretoria. And when they decided to do genome sequencing, they found this was not Delta. That's what they were presuming before. And then once they did more sequencing on other cases, this became a variant which they were concerned about, so they reported it to World Health Organization. On 26 November, it was designated a variant of concern and named Omicron on the advice of the Technical Advisory Group. And this was based on the evidence presented. It has several mutations that may have an impact on how it behaves. So it has about 50 mutations across its genome. By contrast, other variants such as Delta have fewer than 30 mutations, and out of these, 32 affect the spike protein, which is your target of the antibodies generated by infection and the target of your vaccinations. So many of these mutations were not observed in other strains. I'll give you a brief summary on the current knowledge about Omicron. So the researchers in South Africa and around the world are still conducting studies to better understand many aspects. It's still not yet clear whether it's more transmissible. It is more easily spread from person to person compared to other variants, including Delta. The number of people testing positive has risen in areas of South Africa affected by the variants, but it's still not clear whether this causes more severe disease compared to infections with other variants, including Delta. They are seeing increased rates of hospitalization in South Africa, but this may be due to increasing overall numbers of people getting infected rather than specifically because of the Omicron. There is no current information to suggest the symptoms with Omicron are any different from other variants. Initial infections amongst university students were more mild, but our understanding of the level of severity will take days to several weeks. We still need to remember Delta is still the predominant variant, and that's the one we are still fighting worldwide. Our current testing, which is the gold standard test, is a PCR test. It can detect this variant. There are more studies ongoing to determine whether it will have any impact on other types of tests, such as rapid testing. For the time being, we believe the corticosteroids and other treatments will still be effective for managing patients with severe COVID. Obviously, there'll be more data coming over the next several weeks. Preliminary evidence suggests that there may be increased risk of reinfection with Omicron as compared to other variants, but the information is limited. We have to keep this in mind that we had the same concerns with Delta, but we know that with the Delta variant, the vaccines are still effective. And boosters actually are helping us combat that issue as well. As far as the news on that is, on 26 November, BioNTech said that they will know in 2 weeks whether the current vaccine is effective against the variant, and they said that then an updated vaccine can be shipped in 100 days if necessary. Other companies like AstraZeneca, Moderna, Johnson & Johnson are also studying the variant's impact on the effectiveness of their vaccine. So, the thing is, we have to remember the studies also suggest that people can boost their protection against any variant by having the 3 doses of vaccination as well. So this is a variant of concern, but it doesn't mean this is a variant to be panicked about at this point. I'm going to conclude by the statement from Infectious Disease Society of America, which is the premier association representing infectious disease specialists. They released this statement yesterday, and you can go online to look at it. What they said was layered prevention strategies, including vaccination, testing, masking in indoor public spaces, and gathering outdoors when possible, are all important ways to reduce the risk of infection. Increased testing will also help. Rapid testing is an essential part of prevention when available. And the final line, the experience with Delta variant is the lesson for us to remember that increasing vaccination rates, increased testing, masking, and adhering to all national and local guidelines protects health. Thank you.
So we'll open it up for questions for myself or for Dr. Ahmad.
I know testing is obviously newer, but have we been able to tell if anyone has had the Omicron variant here, things like that?
So the question is whether or not we will be able to identify the variant. So testing capacity for genome, yes, we would be able to recognize variants, and that's how our national surveillance system does work in that sense. Now the key though is, as Dr. Ahmad mentioned, PCR testing. That is the gold standard, and that will detect any type of COVID-19, independent of what variant it is. Where there are questions coming up is some of our rapid tests, whether or not they will detect it. So again, when you are looking for testing, we have PCR testing available, especially at the Civic Center site on Mondays, Wednesdays, Thursdays, and Fridays. Fridays and Saturdays, excuse me. And again, also vaccines are available there too.
And then have we had any of the Omicron cases here?
Not yet. We do not have any known of those cases. But having said that, I think we understand that we live in a very globalized society and where travel is very frequent. And so similar to Delta, it is not a matter of if it will come here, but when it will come here.
seeing that with the Omicron variant too?
So right now, I would just say for the Omicron variant, we are still waiting for data. I mean, we are very quick to identify it, and now it's a matter of allowing us the time to study it worldwide. In terms of the variant impacting children specifically, I think you're alluding to where we saw like alpha and beta compared to delta, where kids are much more symptomatic. And again, you know, that's what viruses do. They mutate, and I think Dr. Ahmad can speak even more so as a subject matter on that, but that's always going to be a level of concern. If there's anything you want to add?
Yeah, as far as I said, the severity in like different age groups, again, this is, the thing with this is that this was identified, imagine this was reported on the 24th. We had the first case on the 9th we were collected. It was reported immediately, so it's garnered a lot of attention quickly. So just because, and I think based on our past experience with other variants, I think many countries, everyone is around taking action much more rapidly than we did before. So I think that's where I think a lot of concern comes. But the thing is just like any other variant, we need time to study on this. As I said before, the cases, initial cases were in younger individuals who were university students, healthy or were mild. So at this point, I would say, again, we don't know. There's a lot. I think it's going to be probably going to be the same way. We're going to see infections are probably going to be more severe in people, the elderly, people who are immunocompromised. But yes, regarding certain age groups, children versus adults and stuff, I think we'll just have to wait a couple more weeks for more information to come in this regard. Thank you.
I also have a very, this is a very hyper-specific question, but it's one that my family has asked me, you know, like, oh, can you ask about this? People who received their COVID vaccines and have not yet received a booster, but in the recent past have developed the breakthrough infection. Should those people wait a little bit to get a booster if they're dealing with now if their bodies have both the original vaccine and these natural antibodies and had maybe a rough go with this breakthrough infection? Does it matter when they get a booster? Should they just get it as quickly as they can?
So first and foremost, I think we need to also recognize whether it's a breakthrough case or just a non-breakthrough case, so a person that's never been vaccinated. The vaccines are much more effective in protecting you than having the natural infection. And so we would recommend anyone post-COVID diagnosis, if they've already been in a case before, to get the vaccine. So whether that means they're getting it for the first time or getting the booster, it's essential for them to get the vaccine and the booster. And I'm glad you brought up the boosters. Again, the boosters are now open and really available to anyone 18 and older. And this is, I think someone said it really well, this is a very precarious time we have right now. There's many of us, in fact, close to 54% of our population that have gotten their first round of vaccine and are fully vaccinated. We need them to, again, do what they did the first time around and step up and get their booster. And the reason why is as their immunity naturally wanes after the vaccine, some individuals have maybe taken less precautions than they have in the past. And so then that doesn't necessarily benefit them. In fact, it creates now a larger population again, or more individuals that are susceptible to get the virus. And sadly, every time you get the virus, as we saw in South Africa, there's a good chance that you can then become a host and mutate it further. So even if you've already had the vaccine, and thank you so much for stepping up and thinking about your community, we are now asking you to step up once more again and get the booster. You can come to the health department. We are open 8:30 to 4 Mondays through Fridays. We'll be closed on holidays, of course, but you can get your booster. And anyone that's utilized it will tell you it's a 15-minute process. You come in, you get your booster, and you are out within 15 minutes. And we will be working towards getting not only boosters at the time, people can come and get their first or second dose of a vaccine, and we will be opening it up next week to have walk-ins for children 5 through 11 as well.
And then another question, the increase of 1,000 cases in the past week, what would you attribute that to?
The increase in cases that we're seeing, I would attribute it primarily to cold weather. We're moving inwards, so things such as Dr. Ahmad mentioned, doing things outside, that's becoming less and less accessible. And so as we move inward, where again, our adherence to some of that non-pharmaceutical interventions like masking, social distancing, we're not as necessarily on top of, has created that perfect storm where we are seeing cases erupt.
And I don't know if it's too early to tell, but did you see an increase after the holidays? I know it's only Tuesday, but.
You know, it really is too early to tell, but I will say just anecdotally, we are seeing a lot of individuals that are commenting that they went and got tested because there was someone from their meal that was positive at a family get-together. And so again, you know, it's also really interesting to note that about a third of our cases are in that younger age group that is just now eligible to get vaccinated. Our schools have done such a fantastic job. There's a lot of burnout because they've had a lot of pressure on them from families and from other interest groups and so forth. What we're seeing in cases is not necessarily happening in the classroom setting. However, the things that we do outside in the community impact your schools. If you choose to have a maskless spaghetti dinner for an athletic team, it's going to impact those kids and then what they are able to do in a classroom setting. So again, make sure we are showing those precautions and just not saying that it's only in the school setting. It needs to be universal. We all need to step up to help our schools out and other community agencies as well. Because again, to see those numbers increase, we expected it to increase slightly, but I don't think we expected it to be in a situation where we are right now.
And I know you gave some of the numbers earlier, but we saw in like McLean County there was 99%. They reported that 99% of their hospital beds were in use. Were you able to give like a percentage kind of how we're doing and if we're seeing like a strain on our hospital system?
In terms of our hospital system use, I believe for our region in total, which is Region 2, we are sitting under 20% of capacity. So I think we're at 17.1% right now. But I will say we're, again, at that perfect storm where we have COVID and we have other respiratory illnesses such as influenza. This, again, creates that environment that's straining our already limited resources.
And how is the flu going so far this season, would you say? Would you compare it to COVID at all, cases, or more or less?
It's really hard to assess influenza compared to COVID, partly because I think we have a higher uptake in COVID vaccine than we had with influenza. Likewise, it's really hard to compare influenza this year than last year, where we had a huge support of individuals vaccinating because they could. So really, if you're looking at flu, I would compare it to years previous, such as 2018, 2017, and in that case, it's very comparable to what we're seeing in previous years.
And currently right now, is it a higher, or not higher than previous years, but what are numbers looking like right now?
It's about the same as I would say our year 2017.
Do you know what that number is?
I do not know that number. I will say, though, our health department does do influenza surveillance reporting, and those reports are available on the Peoria City County Health Department website, which is www.pcchd.org.
This might be kind of a frustrating question to get, but it's one that I keep hearing. I want to ask on behalf of our listeners.
Go ahead.
I'm hearing some hesitancy, again, going back to people worried about getting the booster. I keep hearing over and over, why should I get the booster? The vaccine doesn't protect against these variants. Is that something that you're hearing, and what's your response to that? Why should people not be thinking, oh, if it's not going to help, if I'm still going to get COVID even with the vaccine, why get the booster with these variants?
So, yeah, we get these questions on this. The thing is, we know immunity does wane over a bit of time. And yes, I'll tell you anecdotally, I can tell you a lot of people I know who got their 2 shots and now it's been more than 6-8 months. And some of them I know somebody who was supposed to get it like last week and then a few days before ended up with symptoms of this. Thing you have to remember is we know vaccinations are actually one of the most important and effective public health tools for preventing all kinds of infections, but nothing in life is 100%. This is the same way I try to tell them is if there's still a risk I'm going to die if I'm driving with the seatbelt on, then what's the point? It's just like you can do these are all the tools to help you fight this and reduce the severity, reduce the chances of death, severe injury and stuff. So the same way, we all follow DUI laws. We all wear seat belts. Our cars have airbags. Do we still hear of car accidents, for example? where people had all the airbags were deployed, the seat belt was on, but people still suffered a severe injury. I think I try to give the same analogy about these. These are one of the tools of prevention. So same way, you get the vaccination, it does reduce your risk of severe infections, severe illnesses as well. But yeah, we will still encourage them to do other preventive health measures as well. What people forget, I try to remember, people always focus on, severe disease, immediate acute disease, and death, or like that's the most severe consequence. What people forget about is the long-term consequences of this infection. And as time goes by, we'll learn more and more about this again. We're learning people having lasting lung damage, people having the long COVID symptoms. So people forget about those things, that this is not just like, it's a flu, it'll be one and done and you'll be fine. Some unfortunate individuals are going to have long-term sequelae from these infections. So a booster definitely is going to probably help you in that regard from avoiding long-term consequences, even if you have a mild infection after vaccination. Thanks.
Are there any other questions? Okay. Otherwise, we will return to our, I think, normal scheduling for our weekly updates. As usual, Diana Scott and Stacey Peterson will keep you guys posted on what our next steps are. But thank you all.